Good afternoon on a Monday, everyone. I'm David Ushery. 9 months ago, New York was the epicenter of the COVID-19 pandemic, and today, history unfolded in the city as a Queens nurse received the first vaccine in the United States. For many of us, this is the biggest symbol of hope we've had since the pandemic started ravaging the tri-state back in March. Sandra Lindsay has spent months on the front lines. News 4 was the only TV crew there when she got the nation's first Pfizer vaccine. News 4's Andrew Siff live in Glen Oaks to tell us more about this day. Andrew.
David, on this huge medical campus here in eastern Queens, really a huge moment. As you indicated, this nurse was sitting in that room, sitting quietly and calmly in the chair when she got a very critical shot in the arm, which doctors believe marks the beginning of the end of the pandemic.
She said she wasn't nervous, focused, and ready to receive the first coronavirus vaccine in the nation. Sandra Lindsay, a critical care nurse at LIJ Northwell Hospital in eastern Queens.
It didn't feel any different from taking any other vaccine.
Getting the needle with the governor and much of the world watching.
It was a modern-day battlefield.
I asked Lindsay when she learned she'd be making history.
I just found out right now.
In the spring, she treated hundreds of COVID patients as her hospital tripled the size of its ICU.
And you never contracted COVID yourself?
Never contracted COVID myself.
A short time later, Dr. Eve Duraceau, chair of emergency medicine at Lenox Hill, became the second to be vaccinated.
Today is a major, significant day of hope.
The governor said 10,000 people would get vaccinated in New York today, and around the country, the process also got underway after UPS and FedEx trucks equipped with cold storage freezers transported Pfizer vials all weekend.
From this day forward, the vaccine will be distributed, and we will turn the tide on the coronavirus.
I asked the mayor's health team how they'll accelerate distribution.
Do you have any better clarification on how quickly this can ramp up?
The plan is for the doses that are getting delivered over the next 3 days to be methodically and gradually used over the next week to a week and a half.
Back in Queens, the doctor who delivered the history-making shot insists she wasn't nervous.
To be honest with you, I was not, because at the end of the day, my focus is on my patient that's sitting there and is blocking everything out.
And Nurse Lindsay thought about family and friends who've told her they're skeptical about the vaccine.
I want to say to them today that they should trust science.
How did New York end up first? A combination of luck and tactics. The vaccine landed at JFK early this morning, arrived here at the hospital, and then officials here realized Ohio was planning for a 9:30 vaccine, so they moved up the shot here to 9:15. We're live in eastern Queens. Andrew Siff, News 4 New York.
Andrew, I actually want to take a moment here on this day because we have been living, when I say we, those of us as reporters and photographers, living through this with our viewers. We're not just observing it. So you were the only TV reporter in the room when the vaccine was administered. I've seen you covering this just about every day since March. I just want to hear your thoughts, what you were feeling personally as you watched this.
You know, David, the word that pops into my mind is inspiring. It was just after we've all been through so much, after the region has been through so much, to watch a nurse who literally worked on the front lines sit there calmly, patiently, and receive a vaccine was a moment of inspiration. And you just hope that they're able to ramp it up and distribute it everywhere as fast as possible.
Indeed, yeah. We appreciate so much of what she's done and what she continues to do. And you as well, my friend. All right, thank you, Andrew. Now, we need to point out, despite the vaccine's arrival, Governor Cuomo did give a stark warning this afternoon as well, saying we could head into another shutdown if we don't change our behavior. Today's indicators make it clear the second wave does have a tight grip in New York. Hospitalizations increased by more than 300 across the state. The positivity rate is going in the wrong direction. It's going up. It's above 6% in the Mid-Hudson region, a little lower on Long Island, 4% in the city.
If we do not change the trajectory, we could very well be headed to shutdown. And shutdown is something to worry about.
The governor says he's especially concerned about the spread in the city because of density and crowding. Now, it is being called the dawn of a new day in Connecticut. The first batch of Pfizer's COVID vaccine arrived there this morning. More than 30,000 doses are part of the initial rollout. The first shots were given to 15 frontline workers at Hartford Hospital.
This is the dawn of a new day. This is a time for hope. This is a historic moment.
Over the last few months, the things that we've asked of the citizens of Connecticut, social, physical distancing, washing your hands, wearing a mask. As of this morning, we're going to be able to say, get your vaccine as well. So that's a big deal.
Hartford Healthcare has 23,000 workers in its hospitals. The goal is to get every one of them vaccinated within 7 weeks. New Jersey will start administering its first COVID vaccines tomorrow, and it comes as the positivity rate hovers near 11%. The state is reporting more than 4,800 new cases and 25 new deaths. There are now 704 patients in the ICU, the first time it's been over 700 since late May. Governor Murphy also with a stern warning for young people who he says not taking this seriously.
You may be young, you may feel fine and not show a symptom to anyone, but you could be, and I hate to be so heavy-handed about this, you could be passing this on to your parents or grandparents and essentially, I hate to say it, killing them.
6 New Jersey hospitals will start vaccinations tomorrow for their frontline workers, and News 4's Brian Thompson is going to have a full report ahead at 4:30. This all comes as the United States surpassed a sobering new milestone this afternoon. We have now lost more than 300,000 Americans to COVID-19. Just about 20% of those deaths are in New York, New Jersey, and Connecticut.